Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, and good night. Please choose from where you are watching this video. Hello, we are from SMA Negeri 5 Surabaya. My name is Rasya Raditya Pramudia.
My name is Laras Aritani Nabila.
And my name is Shafa Aziza.
And we are going to give you a little bit of preview about what our project is going to look like or going to be. So our project is called the utilization of ASCVD risk calculator application as a method for predicting atherosclerosis through lipid profile examination. So for this project, we've gathered 50 subjects from 2 different regions of East Java with the criteria of ranging between age 40 and 79 years old and contains from both male and female subjects. And then from their blood,
And then we take their serum, in which we have a collaboration with Regional Healthcare Laboratory of Gresik, and then we collect the data that are needed, and then we input them into the ASCVD risk calculator. Without further ado, please enjoy our short explanation.
The plasma preparation. Collect whole blood into commercially available anticoagulant treated tubes, exemplary Gracia, EDTA treated. Cells are being removed from plasma by centrifugation for 10 minutes at 3000 rpm using a refrigerated centrifuge. The resulting supernatant is a designated plasma. Following centrifugation, it is important to immediately transfer the liquid component, or we call it plasma, into a clean microcentrifuge tube using a pipette. The sample should be maintained at between 2 to 8 degrees Celsius while handling. If the plasma is not analyzed immediately, the plasma should be stored and transported at minus 20 degrees Celsius or lower. Welcome to the atherosclerotic cardiovascular disease risk calculator, or more known as ASCVD risk calculator. This calculator is intended for use by healthcare providers. The results should not be used alone to determine medical treatment. This tool is a statistical model and is not a substitute for an individual treatment plan developed by a healthcare provider with personal knowledge of a specific patient. This calculator consisting of various menus which should be fulfilled: current age, sex, race, systolic blood pressure, diastolic blood pressure, total cholesterol, HDL cholesterol, LDL cholesterol, history of diabetes, smoker or not, history of treatment, and lastly, advice. Cardiac risk calculators give a heart disease risk score as a percentage. The lower the percentage, the lower your chances of developing heart disease in the next 10 years. The higher the percentage, the greater your chances of significant heart problems now and in the future. Factors such as medical history and the healthcare provider's experience, knowledge and training must also be considered. This calculator estimates ASCVD risk and provides management strategies for patients aging from 40 to 75 years, or lifetime risk for patients ranging from age 20 to 39 with LDL levels above 70 and below 190 milligrams per deciliters. Risk is calculated using logic from the 10-year multi-ethnic study of atherosclerosis, abbreviation MESA, ASCVD board cohort risk equations, and Framingham 30-year ASCVD risk. The ASCVD risk calculator also predicts your lifetime risk of a heart problem. To determine your score, the tool compares your information to patient data from earlier heart disease clinical studies. Many heart risk calculators classify your risk of cardiovascular disease as low, less than 5% risk, borderline a 5% to 7.4% risk, intermediate a 7.5% to 19.9% risk, and high more than a 20% risk.
Okay, so apparently we are done for today. We just included one of the many data that we have, so we are just going to repeat the same process.
Yes, and the next we must repeat the same process until the data is already input to the application.
And after that, we just like the analyzing thing to analyze.
That's pretty much all from us. We hope you found this video insightful, and we'd also like to apologize whether there are mistakes or errors in our remarks. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.